Ladies and gentlemen, the President of the United States of America, Barack Obama.
That was a great moment, right? Vice President Joe Biden's famous words after Congress passed the health care law. Now, 2 years later, almost 2 years later, it will be on Friday, Republican lawmakers are calling out the president for making promises, they say, that were not kept.
If you like your health care plan, you'll be able to keep your health care plan, period. If you like your doctor, you will be able to keep your doctor, period.
All right, so have those promises held up? Two senators are pointing to several failures, they say, in the law, and they've issued a new report this morning. In it, they say this: we found fewer choices, higher taxes, more government, and less innovation under the new health care plan. Republican Senators John Barrasso and Tom Coburn join me now. They have a combined 50 years of experience in practicing medicine. Senators, welcome. Good to have you here this morning. Thanks for being here.
Thanks for having us.
This is the first time that the two of you have spoken out about the report that you released and your findings, an evaluation of the health care plan almost 2 years later. The president said that you could keep your health care plan if you liked it. Senator Coburn, what have you found?
Well, the CBO has found, and the McKinsey study has found, somewhere around 50% of people are not going to be able to keep their health care plan. And that's simply because a lot of the employers are going to drop their health care plan and force you into an exchange simply because it makes economic sense to do that. The other thing is, with the rising costs, the taxes on insurance, the taxes on medical devices, what we're going to see, even though they have a minimal medical loss ratio to the insurance companies, the prices for insurance is going to go up. So if you're in the individual market, you're going to lose the ability to purchase that because of the pricing.
Senator Barrasso, what we've been told, though, is that there would initially be some increases in the cost of health care, but that once the whole plan kicks in and the co-ops kick in and everybody has insurance, overall, over time, the president has said those prices will start to come down, and they say they have evidence to prove that.
Well, that's not what the American people believe, and we're showing that in our side effects of this health care law. You go to town hall meeting after town hall meeting and you ask the question, do you believe you'll be paying more because of the health care law? And every hand goes up. And you ask, do you believe that the quality and the availability of your care will go down? And again, every hand goes up. People were hoping from this health care law to get the care that they need from the doctor that they want at a cost they can afford. And overwhelmingly, the American people realize that that's not going to be the case.
Senator Coburn, in the piece that you co-wrote, you say that the government loans that will be given to set up these insurance co-ops that will help to insure everybody across the country, ostensibly, you're calling that the Solyndra of health care. Why?
Well, simply because it isn't going to work. You're going to have misallocation of resources, and we're going to be financing it supposedly to set up so that they'll fund and make a profit to be able to keep running. And there's just no way that's going to happen given the large number of people that are going to be running towards this system. And remember, not only, as Senator Barrasso said, are you going to have difficulty with access, once you get access, the quality of care and the level of training that you're going to have access to is actually going to go down, because we're going to be using physician extenders, not physicians, but nurse practitioners and PAs. And for some things that's great, but for most things it's not going to be great. So the co-ops actually will collapse on themselves, and we will have put the money into it and we'll never recoup it.
It's a scary scenario. This is something that the GOP candidates have said that they would fix, that they would find a way to overhaul this health care law. Senator Barrasso, do you think that that's possible given the evaluation that you've made of it?
Well, we have to actually repeal this health care law and put in place, replace it with something that is patient-centered. But this health care law is bad for patients. It's bad for providers, the nurses and the doctors who take care of those patients, and it is going to be absolutely awful for the taxpayers of this country.
Senator Coburn, last thought on that from you as well. Is this repealable? Do you see a scenario if, someone from the GOP is elected to the presidency of repealing this?
Well, I think it's possible. There's a reconciliation can be done on a lot of it. and defunding can be done on a lot of it. So I think that's it's highly possible. The key point is Americans want to be able to have access for health care that is affordable, and we've done everything except the thing we know works, and that's use some consumer input and some consumer responsibility to help control the cost. To ask the question, why does something cost this much? Where can I get it cheaper? Why do I need it? Why are you ordering it? In other words, to start actually applying some market forces to healthcare. Right now, as a physician and taking care of somebody in Medicare, there's no incentive for me not to do whatever I want to do, even though it may not be cost effective for a patient. We need to have those forces if we want to control healthcare costs, keep ourselves competitive internationally, and actually give access to quality care and prevention. One thing I'd just leave you with, 1 out of $3 we spend in healthcare today doesn't help anybody get better and doesn't prevent them from getting sick. We can do a whole lot better job than that.
That's a frightening statistic. Senator Barrasso, Senator Coburn, always a pleasure to speak to you both. Thank you very much.
Thank you.
Thanks for having us.
It's a big deal.
It is.
It's a big deal.